The economic and social costs of the opioid epidemic have a lot of people looking for ways to end the loss of life that is devastating families here in Maryland. WMAR2 News' Mark Roper talked with researchers who are looking for solutions for people living with addiction and their loved ones. So, Mark, what are they working on?
Good morning, Christian. We're here at the University of Maryland, Baltimore, where researchers are looking at ways to stop dependence on the drug. Doctors both here and at Johns Hopkins Medicine hope to prevent addiction from becoming a problem that needs to be treated in the first place.
Some of the best minds at the state's top research institutions believe part of the solution in resolving the opioid epidemic may be rooted in understanding the problem.
We have treated it as a criminal justice issue. It's a health problem. It's a chronic, recurring problem when you have addiction. So one of the things we haven't done is we haven't really said that enough.
If you've worked in the field of substance use disorder for a while, you know that it's very difficult to treat people once they become addicted to a drug. And there's a lot of effort that goes into being able to do that.
Which could come in the form of the Comprehensive Addiction Recovery Emergency Act, or CARE Act, a $100 billion effort proposed by U.S. Congressman Elijah Cummings. If passed into law, it would provide nearly $100 million to Maryland alone to help organizations focused on prevention, treatment, and recovery. Some may wonder why there hasn't been more of a focus on preventing a person's addiction instead of treating it after being prescribed the drug.
There was a lot of emphasis for a long time in finding ways to treat opioid use disorder or drug use disorder once it developed. There's been just less, I guess, interest or understanding of the value of investigating these things.
But obviously, it's no secret for decades doctors have known opioids may be addictive.
I think we thought we were brighter than we were. Back then, there was a feeling that if you gave opioids in the clinic to treat pain, that the majority of patients didn't become dependent.
Several states have filed lawsuits against pharmaceutical companies, blaming them for misleading doctors about the dangers of the drug. Maryland Attorney General Brian Frosh is investigating the pharmaceutical company Insys for allegedly using doctors, pharmacists, and sales reps to increase market share at the expense of patients. Researchers also are fighting back against the opioid crisis, not in court, but on campus. Here at Johns Hopkins Medicine, Dr. Kelly Dunn is leading research that asks the question, what if you could predict addiction?
We were looking at this as a spectrum of how to help people and thinking that if we could reduce the likelihood that they become addicted to begin with, then perhaps we could reduce the burden on the healthcare industry in terms of trying to treat people who have become addicted.
And at the University of Maryland, Baltimore, Dean of the School of Social Work, Dr. Richard Barth says, they're taking an all-hands-on-deck approach that brings together several schools of thought, including pharmacy, health, social work, and law, to create a joint focus on addiction research.
This is a multidisciplinary center that includes all of the professional schools here at UMB, and that focuses on those four things: on workforce, on systems of care, on research, and on policy.
Meanwhile, some consumer advocates partly blame the Food and Drug Administration for continuing to approve more opioids to be put on the market for doctors and their patients.
Unfortunately, they sort of look too narrowly at just the data where the drugs were tested in clinical trials and don't think and assess more broadly how their approval actions, if that's the decision they choose to make, are going to adversely impact public health.
Now, one approach to the problem includes prescribing other medication that you may have heard of, such as the detox drug, methadone, or the opioid overdose antidote, naloxone. Tomorrow morning on Good Morning Maryland, we'll hear what researchers think about those drugs as part of the path to recovery. We're live in Baltimore. Mark Roper, WMAR2 News.
Yeah, that's a big issue in the community. Thanks, Mark. We'll look forward to that. By the way, if you've got any questions about opioid overdoses and pain management, you can join me tomorrow morning. I'll be on the WMAR2 Facebook page fielding questions along with two experts on opioids and pain management from GBMC. If you've got a family member struggling with addiction, or if you or your family are dealing with chronic pain and you want some ideas on dealing with that without opioid medications, we have some ideas for you. That is tomorrow morning on the Facebook page at 10 o'clock.